My name is Jared Henricksen. I'm a pediatric critical care doctor at Primaries and involved in a lot of simulation-related things. This study is about stress, the appraisal of stress, cognitive appraisal of stress by simulation participants. And stress appraisal can be determined when filling out validated studies or validated surveys. And so we had simulation participants fill out these surveys. Challenging stress is needed to help us get things done and be able to be productive. Threatening stress is scary, and you don't want any part of it. And so the surveys were able to distinguish between threatening stress and challenging stress before and after a simulation experience. Our hypothesis was that most simulation participants would be in the challenge category rather than the threat category. We thought most participants would be ready to learn and go through and be able to learn in the debriefing. We put 485 people through simulation, and they filled out the stress appraisal surveys before and after the simulation event. And so you can picture perhaps a 2x2 table now. And on the left you have pre-simulation, on the top you have post-simulation, and the two categories are threat and challenge on both of them. So you can go through, there's 4 categories now. You can go through and be challenge pre and challenge post, that's one category. You can be threatened pre, threatened post, that's another category. Or the opposite, challenge threat and then threat challenge. So 4 categories, and so we had people fill out surveys and then looked at the results. You can maybe guess which category was most popular, if you want to put it that way. The challenge category had 68% of people. The threat had 6%. And then the threat pre and challenge post had 16%. And then the challenge pre and the threat post had 10%. So the majority of participants experienced simulation stress as a challenge before and after their simulation, and far fewer experienced simulation as a threat throughout their simulation. This study is important because it shows how simulation participants appraise their stress created during the simulation event. The vast majority of participants appraise their stress as a challenge, and we think that means that they're ready to learn. The most interesting category to me is the challenge threat category, because they were ready for simulation, and then they go through simulation, and now they're threatened. And so that was 10% of folks that went through simulation. The limitations of the study include that the students, residents, and fellows were lumped into one category. A lot of nurses took this survey, and so it's hard to distinguish between a student and a graduate level trainee. Post-simulation survey, or the surveys were done pre-debriefing. And so they went through simulation and did the second survey before the debriefing. And so a limitation of this study is that we don't know the effect that debriefing actually had, because we wonder if the debriefing could actually even make them less threatened, because during the debriefing you usually learn something, and I would hope that learning helps decrease the threat that they might feel. So because the majority of participants are ready for a simulation challenge that will build their abilities and stress capacity, we think that pragmatic debriefing with emotional surveillance might be a method instead of concentrating on emotions after the simulation event that might take time away from the learning opportunities in simulation. And so lots to think about. The idea of stress, I see a lot of things published that say we just need to get rid of stress, and I don't think so. I think we need stress in healthcare training to build our stress capacity to be able to handle the hard things. Healthcare is not easy, and we need to be able to train our folks to improve their stress capacity to understand how it is and how to improve. So that's the stress appraisal study in simulation. Thanks.
curious because I see PAs there. So how did you didn't break it out by
Not enough providers.
Okay.
So we had far fewer providers than we had nurses.
And PAs?
Yeah, not very many PAs at all.
Okay.
It was, yeah, not very many.
What is your sense on that? I mean, do you feel like, I mean, this would be a great study, right? Like, is there a difference? Because, you know, I don't know. I mean, like maybe there's an age difference. Maybe there's a increasing resilience among.
We did try and do some demographics, like how much simulation have you done?
Right.
And what level of training are you in? And we actually did an anxiety score. And so we did the GAD-7, if you're familiar with that. So that was in the pre. We didn't do it pre and post because you just have to do GAD once. The stress appraisal surveys were done pre and post. And so we actually found that simulation challenge was associated with going through simulation more and less anxiety at a baseline.
That makes sense.
Yeah.
Yeah. And then also, it's fascinating, was there a difference in male and females then?
No, I don't think so.
No? Okay. Good. No.
That's a question.
Well, with all your work with debrief, Jared, are you going to repeat this to see if a debrief does change a threat to a challenge?
Yeah, the reason why we didn't do it is because of survey fatigue and doing one pre and then post and then post debrief. And so we could. I think that would be an interesting thing to see. How effective is debriefing? Please.
For those of us not familiar with these simulations, could you give a couple of examples of what types of stress you're trying to induce, like kind of how they run, that sort of thing?
These simulations were done at Primary Children's Hospital, excuse me, and they had to do with mostly codes, rapid responses, and then doing CPR. And so that's the type of simulations they're mostly used to. Did that answer your question?
Stressful.
Stressful.
Specific time factor involved in everything.
The simulation events were 10 minutes or less.
Cool. Very nice.
Thank you.
Thank you.